Good morning. It's Monday, August 9th. Thanks for joining us on Up to the Minute. I'm Dr. Nicholas Cox, the History Department Chair, and I'm here with my co-host and History Department colleague, Dr. Natalie Garza. Uh, Dr. Garza, would you tell everyone how to find us online?
Yes, good morning, Nick. We're live on the Houston Community College District Facebook page. That's Houston Community College, not HCC. We're also on YouTube, and we're also on X, LinkedIn, and on HCC TV at noon, 5, and 10 p.m. Monday through Friday.
Thank you. And thank you for co-hosting with us today. How was your weekend?
It was good. I saw family this weekend, so it was nice.
Oh, excellent. Excellent. I ran out to Prairie View for the Texas Oral History Association meeting and saw a lot of our mutual friends. It was a good event.
Yeah, I was sad to miss that.
Well, it'll be a Baylor next year. There's always another conference every
Yeah.
month, every year. All right. Well, today for Mental Health Monday, our longtime monthly guest is discussing depression in men. Dr. Sean Fitzpatrick, Executive Director of the Jung Center of Houston. Welcome back to the show.
Thank you for having me.
Well, first, we will welcome back a guest from Coleman College, but after the break, we'll sit with Fitzpatrick and talk about depression in men. Our guest today for the first segment, though, is Dr. Carla Tyson, Program Director for Health Information Services at the HCC Coleman College for Health Sciences. Welcome back to the show, Dr. Tyson.
Thank you for having me. I'm always happy to be here.
Oh, that's great. I understand it's been a while. Do you remember what you talked about last time you were here?
Could it
I
have
put you on
been
the spot there.
health information technology?
Okay. All
It
right.
was
Yeah,
probably health information.
that's your expertise right there. So let me ask a question. Can you tell us a little background information on what is health information technology and why we changed the name from medical records and what has changed over in HIT?
When I first started in this field, it was called medical records. And that's because what we did was we managed paper. We managed the discharge summaries, the history and physicals, the notes that physicians and clinicians would document on. They documented on paper. But after a while, we realized that electronic health
Those are
records were
for-
a lot more convenient. So we moved from paper to electronic records.
And that shift has changed the way we train our students then. So if you could describe the health information technology program here at HCC, what kinds of environment does Coleman provide for its graduates and its students?
Well, all of our classes are taught online. So we have online lectures as well as labs. And then we have face-to-face clinicals where we put students for hands-on training. For instance, it's a 2-year associate degree program. They get all their lecture and information online. And then they have 4 clinicals. 3 of those are virtual. And we also have in those 3 virtual clinicals what we call grand rounds. And the students, they get to interact with students the whole nation. And then their very last clinical, we put them in a hospital or a clinical environment for hands-on training.
And what is ICD-10 coding and electronic health records? Could you talk a little bit about that?
Yes, most of our students come and get their degree in health information technology because they want to be coders. ICD-10-CM and ICD-10-PCS is a method in which the diagnoses and procedures are translated into alphanumeric codes. These alphanumeric codes help us store what transpired to the patient. So when we need to do data analytics and pull back what happened to the patients, how many patients there were with this particular diagnosis or procedure, it's easy to go back, pull that information, and analyze that information. For instance, during COVID, when you would watch the news and they would say X amount of people were diagnosed with COVID or died from COVID, it is health information professionals who are the ones who provided that information.
And so this technology allows for the more efficient storage and analysis of that data. Okay. So
Most definitely.
do uh do people working in the field need graduate do they need credentials? Do they need something in addition to this certificate? How does that work in the workforce for them?
It behooves them to have their credentials in addition to their degree. Once they finish their 2-year associate degree, they can sit for their Registered Health Information Technician or RHIT credential. A lot of employers not only want that RHIT credential, but if they're going to be coders, they also want an additional credential such as a CCA, Certified Coding Associate, CCP, Certified Coding Professional, CPA, and also CCS, Certified Coding Specialist.
So whenever I talk to our programs on the workforce side of things, I learn so much. And are these credentials, the RHIT and the CCS, are these state licenses? Are these Texas or national? How does that work?
You know, what's really good about them is that they are not state level. They are national. It's a national credential. So no matter where you go in the United States and also Canada, these credentials transfer with you.
Oh, that's wonderful. You know, a 2-year associates
Yes.
and one or more of these credentials and licenses would be continental, say.
Yes, yes, most definitely. And what I like to think about our students when they graduate with us, I like to look at HCC as a place where you can go from being on welfare to in 2 years, we can get you to the middle class. You may come to us on financial aid. You may come to us on welfare, but in 2 years, Houston Community College.
Yeah, we can really be a step ladder for working people into
Yes,
more affluent middle class life. So
yes.
what's the market like for these health IT workers in Houston? What about most of our students are going to likely stay and work here in the Houston area. I think that's fair to assume. But what's the market like here?
Well, the market's pretty good. We have 100% placement of our students. But I also like to remind students, especially when they're new, that they may not get their dream job immediately in the Houston area. So they may have to go and work in the rural parts of Houston, the rural parts of Texas. And when they get that experience, then come back to Houston. And one of the reasons is because not only does Houston Community College have the associate degree that we offer, but students can also progress to get their baccalaureate, their master's, and their doctorate in health information or health informatics.
And if a student in Houston wanted to do that, would the schools in Houston include places like U of H to get those advanced degrees? Where do our students go next if they want to keep adding more degrees and credentials?
In the Houston area, you can go to Texas Southern University for your baccalaureate degree, the University of Texas biomedical informatics program for their master's and their doctorates in health informatics. Okay. Which is also real convenient for our Coleman students because it's right across the street. They can walk from Coleman right over to UT.
Yeah, UT's right there in the Med Center, just the same as us. All right, wonderful.
Yes.
So students who are pursuing this or maybe thinking about starting this are always going to want to know, what's that kind of range in terms of income? Like, what kind of salaries can they expect?
Our students, once they graduate, they're starting at around $50,000 a year.
All right. So you mentioned that students often can get jobs in hospitals, perhaps even health departments or ambulatory care clinics providing health care. But where else might a student with one of these trainings go?
They can also work for places like CDC, where when they were the ones who were looking at these COVID statistics, they can get jobs in pharmaceutical companies. They can get jobs at the health department. My very first job out of college was actually with the Texas Department of Health, where I would do tumor registry. So that's another avenue for health information professionals.
No, that's good to know. I don't want people to assume that if you get this job, you're working in a doctor's office, right? There are many other options.
Yes.
So we've got about a minute left here, and I wanted you to tell us what is Coleman Midtown? What's going on there?
I'm so glad you asked me that question, Nicholas. I'm excited about Coleman at Midtown. I even love the name. It is so jazzy. But what we're doing is we're offering students another opportunity, another place to get these same Coleman classes. We're offering them, we're offering health information, technology, medical terminology as hybrid classes. We're also planning to offer more health information classes hybrid during the spring semester. We're also offering medical assistant classes, as well as licensed vocational nurses classes at Coleman at Midtown.
Well, I was surprised to see the rapid build out in 3100 Midtown of the classrooms that you guys have been using now for this fall semester. So it's been a real accomplishment to turn some of that space into teaching space. And I think expanding Coleman to a second campus might really help you grow that program and meet the local demands in the market.
I think so too. And it does look snazzy, doesn't it?
It does. It does.
Yes.
All right. Well, thank you so much, Dr. Carla Tyson, Program Director of Health Information Services at HCC Coleman College for Health Sciences. We'll have more information about your programs in our post after the show.
Thank you. I appreciate being here.
All right. Up next, after a commercial break, Natalie will talk to our Mental Health Monday guest about depression in men.
When I grow up, I want to work in a lab to build robots.
From classroom to career, we're with you every step. Register for real-world education at hccs.edu.
That one day at PE when they were like yelling at me and then you just linked arms with me. I don't think you know how much like that helped me. I finally like knew that I had somebody.
Hi, we're back with Dr. Sean Fitzpatrick, Executive Director of the Jung Center of Houston, and our Mental Health Monday guest. Welcome back to the show, Sean.
Thank you so much for having me back.
So let's start by talking about Pedro Pascal, the actor. And there was a video that was misunderstood and went viral. Can you tell us a little bit about that?
Yeah, it's been a really fascinating moment for me to watch as a mental health provider, and I think ultimately a hopeful one. So over the summer, there was a video that played of Pedro Pascal at San Diego's Comic-Con, and he was promoting a new project, and his co-stars, his name is Vanessa Kirby, was there with him. And there's this moment where he walked over, and it looked like he put his hand on her shoulder, on her back, and she reached around and grabbed his hand and held it. And of course, the immediate thing that people assumed was that the two of them were romantically involved now, and so there's a lot of gossip around it. But something different was going on. So he's been very public about his struggles with anxiety. And one of the things that helps him when he's having a panic attack is making physical contact with somebody else, which is actually quite common and is a lovely way of grounding yourself, as long as we have permission to do that. And so that was actually what was happening, was that he's been very open about how stressful those kinds of events are, being out in public in that way. And so he'd reached over to his friend, Vanessa Kirby, and she helped to steady him. What about it? There's a lot of hate that specifically targeted his masculinity, right? Because he's a man, he's supposed to just suck it up and get over it. You're not supposed to be paralyzed by anxiety. That bias is real and alive in our culture and has so much to do with the ways in which men do not seek help or don't even really recognize in themselves that they're struggling. But I think we're also at a kind of a turning point with this. First, because of the big pushback to the haters that then showed up on social media and elsewhere, people really defending what was going on in the video, or what they imagined was going on. But I think secondly, and more importantly, it's in what he is doing himself. Like, he's choosing to use his visibility to talk about what is incredibly difficult to talk about. He's talking about his own mental health struggles as a way of making them less invisible, because they frequently are. Men's mental health struggles are frequently invisible to the rest of the world.
Yeah, I mean, I think it's fascinating because Pascal has been, such a huge star. He's been everywhere lately.
Yeah.
And, on all the talk shows, on all of these shows. And so he's extremely popular. And so,
Mhm.
for him to be speaking out on this is really interesting. And I think bringing a public face to men's mental health. Why would you say it's invisible? What are some of the barriers to seeing and addressing men's mental health issues in particular?
Yeah, so generally they're a mix of cultural and physiological probably factors, biological factors that are at play here. So we'll start with just the experience of men's experience of mental illness. There is evidence that men experience some mental illnesses differently than others. We could go so far as to say that some mental illnesses generally get coded as women's mental illnesses, and other mental illnesses will get generally coded as men's, which is not true. It's not really valid when you look at the research. So men are typically diagnosed with depression less frequently than women, but there is newer research that suggests that when you use different behaviors, when you look at risk taking and experiences of rage, and you include those in the ways that you screen for depression, that the incidence of depression among men and women is actually pretty equivalent. So women attempt suicide more frequently than men, but men are 3 to 4 times more likely to die by suicide. They tend to use more lethal means, but the signs are also much harder for people around them to notice. And I think a lot of this has to do with the expectation that masculinity and expressing emotion are contradictory. That we're not supposed to, or we're not able to. Another is the expectation that men will use their strength to overcome challenges, and that men who can't overcome emotional challenges are morally deficient. One of the most tragic examples of this comes from the history of military veterans. For most of the 20th century and well before, soldiers who experienced PTSD were told that they were moral failures, right? So this was something that they were wrong and weak. And not courageous, and there was no treatment offered for it. It wasn't understood to be a disease or an illness or a condition, right? So it wasn't up until the Vietnam War, which is in my lifetime, that this story began to substantially change.
So yeah, it sounds like, looking at the symptoms of depression and things like that differently is one thing that we can do in terms of men's mental health. What are other things that we can be doing?
Men generally are less likely than women to seek medical assistance, right? This is a tendency that's pretty well documented, not just for mental health. What I would say is that all of us can really work to notice and support men's emotional lives, right? So often I think men are not actually, and this can be true of anyone, it doesn't just have to be men, but I think men often are not actually aware of what they're feeling often. So even that level of being curious can be helpful for men to actually pay attention to what's going on within them. And I feel like containing that concern that we would express in language that emphasizes strength and courage can help. So someone like Pedro Pascal, I believe, takes enormous courage and strength for him to speak, for him to talk about what's actually going on, because we can see what he risked, right? We can see that there's this intense, the haters show up, right? This intense cultural backlash against even speaking the need for men to have support for their mental health. We have to talk about it more as a bottom line. And, I would say also, and this is a special appeal to HCC students who may be watching, I think we actually need more men in the behavioral health workforce, just as we need more people of color in the behavioral health workforce. They are wildly underrepresented among the professional class, and it's difficult to reach out. Can be difficult for men to reach out for help if they don't see somebody who they might feel some similarity with in the chair across from them. So, the vast majority of new and early career social workers and psychologists are women. Again, like if there are HCC students who are watching this who might be looking at their career path, I would definitely encourage a path toward mental health. No matter what gender you are, we're in a mental health shortage. Actually, in Harris County is designated by the federal government as an area where there's a significant mental health shortage, professional shortage.
Yeah, I think I'm feeling that a lot. I have young children in school age children, and we're seeing that a lot, just talking amongst parents and the administrators at the schools.
Yeah.
So this is an appeal for HCC students, right, to consider mental health as a profession. Thank you, Dr. Sean Fitzpatrick, Executive Director of the Jung Center of Houston, and our Mental Health Monday guest. We'll have your info in our post after the show.
Thank you so much for having me. It's great to see y'all.
Coming up, and after a quick commercial break, Nick and I will return with some news and announcements.
When I grow up.
From classroom to career, we're with you every step. Register for real-world education at hccs.edu.
If you love them enough to crawl into a play place to get them to come down, then surely you'll check nhtsa.gov/the right seat to make sure they're in the right car seat.
Today I'm going to talk to you about physics. Come on in, girls. Let's go. This is the first rocket to get humans to Mars.
Really tall.
I'm a rocket structural engineer, designing and building parts of the rocket. You are the generation that will be stepping foot on Mars. Do I have a group of astronauts on my hands?
Yes.
You can become a rocket scientist or whatever else you want to be.
All right, well, Natalie and I are back with some news, events, and announcements. First up, the We Care Lunch and Learn sessions. HCC will host a series of We Care and Mosaic and Me lunch and learn sessions throughout September. These are a great opportunity to connect, learn, and support the new Caring Campus initiative. There will be giveaways, so make sure you take notes. They're going to be at noon to 1 p.m. And coming up next is Tuesday, tomorrow at Brays Oaks, and Thursday, September 12th at the Northeast Campus. You can see our post after the show for links to register.
September is Suicide Prevention Month. The HCC Counseling and Ability Services invites you to attend this virtual event to help understand the roles of substance use in suicidal behavior. This is presented by the Harris Center for Mental Health and IDD, and the event is open to students, faculty, and staff. It's happening noon on Tuesday, September 17th. It's again virtual on Teams. Check our post after the show for more info.
All right, also, you can pamper yourself because there are free facials at Alief-Bissonnet. HCC is now offering its free facials at the Alief-Bissonnet campus on Tuesdays this fall. These free moments of pampering give our students experience and our faculty and staff a break from the daily grind. They begin Tuesday, September 17th. Check our post after the show for more information.
We have a faculty art exhibition at the Northline Gallery. HCC Northeast is currently featuring the works of Victoria Dorsch in Harmony and Contrast, Visions of Freedom and Harmony in the Human Spirit. This is on view at the Northline Gallery, and there is an artist reception, which will be held later this month. The exhibition runs through November 1st. The artist reception is taking place on Tuesday, September 24th from 2 to 4 p.m. at the HCC Northline campus. And the exhibition is free. Everyone is welcome. Check our post after the show for more info.
Just wanted to note there, Victoria Dorsch, and would really love to see people turn out and see her art. All right, the next announcement we have is HCC's new NOW program, Maintain Balance and Earn a Degree. Some part-time students can achieve their dream of earning a degree with the One Now program, which stands for Novel Online Way. Designed specifically for part-time students, they can take one class every 5 weeks to earn their associate degrees. Check our post after the show for more information.
And fall registration continues. Second Start is available for registration right now with the the second start, and there's other smaller semesters available in a variety of programs. HCC's courses are offered in a range of modalities, online anytime, online on a schedule, hybrid in person, and hybrid lab. So to learn more about HCC programs, start dates, and options to cover costs, go to hccs.edu/apply.
Okay, and coming up later this week, we'll have some special guests on the show, including the annual Galveston Sandcastle competition. And later, the Friends of River Oaks Theater will discuss previewing Peter Sellers' last and possibly best film. Thank you, Natalie, for co-hosting with me.
Yeah, thank you. I think we had some great guests today.
And thank you, everybody out there, for watching. We'll see you next time.